Welcome to the intersection of technology, cybersecurity, and society. Welcome to ITSPmagazine. Knowledge is power, now more than ever.
Hello, everybody. This is Marco Ciappelli. Welcome to an episode that is on Redefining Society podcast, but also particularly dedicated to the CES conference that is going to happen very soon in January in Las Vegas, which is what a lot of people call it, the place where you see the future. Now, I don't know if there are crystal balls there or time machines, but definitely technology is a way to look at the future. And for me, it's all about the way it fits into the societal structure that we live in. A lot of things going on lately with artificial intelligence, advanced technology. And of course, there is one industry, one sector where technology is really relevant, is certainly in the healthcare. So today, I am very happy to have Jesse Ehrenfeld on the show. He is the president of the American Medical Association, and he's going to run a panel at CES about enabling the new era of value-based care for digital health. So that's a mouthful. I think we'll figure out what that is. But before we even go any further, I want to welcome Jesse to the show. And so here you are. Welcome to the show.
Marco, thanks for having me. I'm super excited about CES in January and to have the opportunity to talk about how do we get to value-based care using technology, critically important topic for all of medicine and all of healthcare, which I think a lot about in my role as leading the American Medical Association.
Yeah, absolutely. And I feel like a lot of people that follow the show and they are passionate about CES, they already know. We had a few conversations where we say, CES is not really, as I was joking about the future, it's not about the gadget anymore. It used to be about the radio at the beginning, and then it grows with technology. Now we're really looking at the intersection with society. So let's start with defining what is the value-based care model.
Yeah, it's an important place to start. So value-based care is a term that really describes healthcare that is designed to focus on the quality of care, the performance of the people delivering the care, and the patient experience. And that word value in the phrase value-based care really refers to what the individual patient values the most. And as we think about how do we elevate quality, elevate performance efficiency, prioritize what patients want, there is no way we can do this without embracing technology, embracing digital health tools, thinking about leveraging the power of AI to make things more efficient, more effective, and to get us to a paradigm of delivering value-based care.
Well, that's an ideal situation, and I hope we will get there. And I think technology can definitely help with that. Would this be possible conversation, let's say, 5 years ago? I'm going into generative AI and all the things that happened lately.
I mean, I think so, but we have different set of opportunities today because the technology stack is very different. Having patients engaged in their own care is one really important element of value-based care. And so as you think about the tools and the technology and how we interact with patients, I'll see a patient, I'm going to be in the operating room tomorrow. They'll spend a little bit of time with me having surgery. I'm an anesthesiologist, so they'll be asleep for most of it. But my direct interaction with the patient is a tiny, tiny fraction, right, of their life. And then there's the rest of patients walking around, being at work, being at home. And the way that we can use tools to help keep patients on a journey to health, help them engage and take ownership of any medical problems that they have, is becoming increasingly possible through the use of technologies and apps and algorithms that allow us to have much, much more high touch and interaction with patients in ways that just wasn't possible 5-10 years ago.
Yeah. So here is like a personal way that I see things. If I can do a video call with my specialist, with my doctor, I'm happy to do that. I
Sure.
save a lot of time.
Yep.
I don't have to drive on the 101, the 405 here in LA. So it's like, it's good value.
And you can do it in your PJs.
Exactly. On top of that, you still have that interaction. I think we got used to do some of this thing, work remotely nowadays. But the question may come into, are the tools available for everyone, or when they will be, so that you don't even have to really go to the lab. I mean, I don't even know if we're ever going to get there where you can pinch your finger and do your blood test at home.
There are companies that will send you a kit in the mail that you can do some of the testing at home and send it in. Hasn't really hit scale yet. What I'll tell you, though, is it comes down to the tools, in the technology, in the devices and the apps. And we're seeing a lot of movement in this space. I talk to physicians all over the country. AMA does a lot of survey work. We know a lot about physician priorities for the adoption of digital health tools. And the fundamental priorities are actually quite simple. Physicians want to know, does the thing work? If I buy something, I put it in my practice, I integrate it in my workflow, is it actually going to live up to its expectations? And that actually is a foundational question, because we have had a lot of hype around a lot of tools that have just not lived up, right, to real world experience. And the case in point is the electronic health record, the bane of most physicians' existence, the number one pain point for at least a decade running because of usability problems, lack of interoperability, adding lots of checkboxes and clicks without really adding a lot of value. We can't let that happen if we want people to actually adopt and use these tools. The second issue is, who's paying for it? If I go through the acquisition cost of acquiring a tool or an algorithm, is insurance covering it for the patient, for me as the practice? Those payment issues are obviously important. The third issue is, what happens when something goes wrong? If there's a failure of an algorithm that's embedded in a device, a medical device, if something's not anticipated with a patient, who's on the hook? And our perspective, obviously, is that there's likely to be a shared liability in most circumstances that's appropriate. If I use a tool or an algorithm or an app as directed, either as a patient or a practitioner, in many cases, it probably is the manufacturer, the developer, the implementer who ought to hold most of the liability. But those questions are actually unsettled, and there are federal proposals that actually have indicated that it may not be what you would expect it to be, that we need to work through. And the last question is, does it actually work in my practice? And I see adult patients, and I will own it. I've made this mistake. I'm an informaticist. I've developed algorithms and tools and technology, and I once back in the day, 15 years ago, developed some software. And the thing, they teach you this in medical school. Children are just not little adults. They're different, and they behave differently. The workflows are different, and I completely ignored that. And we deployed our software in a children's hospital that we developed in the adult hospital, and it just failed miserably. The workflows were different. We didn't anticipate that, and it was an important lesson that I learned, and I should have known better. And we see this problem over and over and over, where technologies are developed in one setting, in one healthcare system, in one region, in one population, and then when we try to scale them to all patients, they just don't hold up. So those are the real questions that physicians want to know. Does it work? Is it covered by insurance? What happens when something goes wrong? Does it actually work in my practice? And we want to make sure that we, as an AMA, connect entrepreneurs and innovators directly to physicians, directly to doctors, so that as we're getting new technologies brought into the marketplace, that we have excitement for tools that actually work. And there are a lot of ways that we're doing this. We're doing this through our Physician Innovation Network. We're doing this through work in venture capital, a technology incubator that we created in Silicon Valley called Health 2047 that's spinning off companies. And obviously, there'll be a lot of conversation at the show about how do we do this in a way that makes sense for patients. Yeah,
that's the point. It's like other field. I mean, like autonomous car. I feel like the technology is there.
Yep.
All the conversation I have about that, but we haven't kind of pulled the plug on say, okay, we're comfortable to have these cars on the road. We know that they're at least good enough or better maybe than us to avoid accidents.
Well, Marco, listen, I fly all the time as I travel around the country, and there's still a pilot sitting in the front of the plane, and we have autopilot, not just for in-flight, but autonomous takeoff, landing. Those systems exist. There's a reason that we haven't, as a society, said that we want that to be in command and control. And I think we have a similar trust issue in healthcare. Healthcare is so personal, right? There's nothing more personal than healthcare. Your genetic code, disease and illness and health, and we want to make sure we get it right. So, our perspective on AI is we ought to have a human in the loop, like the physician or the healthcare team member. We want to use these tools to boost capacity, to move performance to that definition of value-based care, where we can focus on high quality. We can elevate the performance of our teams. We can shape the patient experience to be more meaningful, more engaged, more frictionless. But we need to do that in a way that obviously makes sense and works for everybody.
Yeah. So let me put it from this perspective, because I like to put myself in the shoes of both sides, right? So you told me what on your side of the medical practice and what all the things that you guys are doing. Now let's put ourselves for a second in the shoes of the patient.
Sure.
Right? So how do the patient measure value or success when he adopts a new technology that you say, look, you can do it this way. You can come in the office, but you can also call me from home or use this tool or how society, you feel like psychology of the patient need to be moved to start adapting to that and get the value of it.
Yeah, well, so it's interesting, and of course there's a lot of data on this, but the experience of the patient is paramount, right? The frustration of as you mentioned, sitting in traffic, driving to the office, people are running late. You spend half a day, having a 30-minute visit or a 20-minute visit or 15-minute visit. That is a very unsatisfying experience for a lot of patients. So using telehealth, remote tools to solve some of those challenges is obviously a big satisfier. We see this in patient survey data. Quality, right? The tools ought to make things better, make things more efficient, make them higher quality, so that when you go in for a diagnosis because you're not feeling well, that you get the right answer. And we ought to get the right answer more of the time than before, using the tools that we have that can support diagnostic decision making or imaging or procedures, robots and endoscopies and all these things that are starting to incorporate more and more AI and other technologies. And then cost, right? We want things to be lower cost, out of pocket to the patient. And unfortunately, that has been a challenge. Healthcare costs continue to go up, but that's a driver of the whole value-based care movement, is to try to create the efficiencies that can ultimately lower costs for patients, which are becoming unmanageable and unsustainable in a growing portion of domestic GDP.
Yeah, so you mentioned how we have already been living with AI for a long time, except that you didn't know. It's backstage. It's kind of like I always use the Disney World or Disneyland example. Everything is pretty, but there is a lot going on backstage to make things pretty and working well. And we don't care as a user. Yeah. We don't really care.
Well, in fact, that's happening in healthcare today. So 40% of U.S. medical practices use AI, but it's the unsexy stuff. It's supply chain management. It's scheduling. It's dealing with insurance companies and prior authorization. Things on the back end that aren't really visible to physicians or patients. The exciting stuff, right? when you walk in and you have a stethoscope that helps me hear the heart sounds and understand what I'm listening to. If there's something that is 1 in 100,000 condition. Those are applications which I think people think about when they think about AI and AI tools. They're coming quickly, and we want them, we need them. But the place that AI is in use today is that sort of stuff in the background layers you're kind of describing with the Disneyland example.
Right. How about in research, though? I mean, I talk a lot about AI in terms of being the first layer of aggregating data and doing the job that would take a very long time to an individual. But then the individual is still obviously in the loop, the professional in the loop to make that executive
Well,
decision.
you look at what the pharmaceutical industry is doing, using AI tools around drug discovery, right, for rare diseases, common diseases, and they're really exciting examples where companies have been able to very, very quickly identify drug targets, therapeutic targets, protein structures in ways that would never have been feasible before at a much reduced time frame at much reduced cost. So, and there are lots of examples across biomedical research where this is starting to happen. So there are definitely research applications that will impact human health in the near term.
Very cool. Let's spend the last couple of minutes talking a little bit about CES. You said you're excited about going there. I don't know if it's your first one. I'm assuming it's not, but you tell me. And kind of like the whole ecosystem of an event that, yes, it has all the different, the healthcare, the space, the food, and the robotics, cars. I mean, there is everything. The whole society is represented there. What's the value for you of an event like this or a similar event like VivaTech in Europe, for example?
Yeah, well, I'm certainly excited about it. I've only been virtually. I've never been to Vegas. Okay. So look out, here I come. Super happy to join 150,000 of my closest friends that week. No, it's exciting. And I think it's so important. And I'm delighted that CES is really highlighting digital health as a part of the show this year, and I think in an elevated way, because it's foundational to so much of what's happening in technology development and so critical to obviously society. Without health, we have nothing, and it's such a growing part of the economy that understanding how do we get tools that actually work, how do we have development cycles, how do we connect entrepreneurs and innovators to healthcare in ways that lead to better products with better go-to-market results is absolutely essential. And I know that CES is going to contribute to that in a really productive way, certainly through our panel, but through other activities as well.
And that's exactly the last call we're going to have. It's to remember that you will be leading that panel. It's called Digital Health Enabling the New Era of Value-Based Care, Wednesday, January 10, 2 to 2:40 p.m. And the North Level 2. I'm sure you already forgot about what I just said, but there will be links in the episode notes with the way to get in touch with Jesse, and especially to know more about his presence there at CES this year, which again, it will be happening Las Vegas 9th to the 12th of January. Jesse, great conversation. I would love to have you back and with more time and talk about other things, the way that healthcare and society are so intertwined, and a very, very important topic. Thank you for your time.
Thanks, Marco. Appreciate it. Bye.
All right. Take care, everybody.
If you learned something new and this story made you think, then share ITSPmagazine with your friends, family, and colleagues. If you represent a company and wish to associate your brand with our conversations, sponsor one or more of our columns. We hope you will come back for more stories and follow us on our journey. You can always find us at the intersection of technology, cybersecurity, and society.